Hey guys, it's your favorite pipeline nurse practitioner. My phone memory was full, so I couldn't make any recordings, but I am back. And today I am talking about farming. Just today, I had 2 people ask me about fertilizer dust. The acute symptoms of fertilizer dust are pretty much the same across the board, but it does depend on what exactly you're working with and what is in the fertilizer. Oftentimes fertilizer has urea, different types of ammonia, phosphate, potassium or potash, lime, that kind of stuff. And they are all airway, skin, and eye irritants. So if you're putting fertilizer down and you get a big old whiff of it, expect possibly eye burning, nose and throat burning, cough. If you're prone to asthma, you can get chest tightness, wheezing, shortness of breath. It could throw you into an asthma attack. Fertilizers aren't inherently cancerous. Long-term risks really are just lung problems, so chronic cough, chronic bronchitis, worsening asthma. A well-fitting N95 is sufficient because it'll catch most of the large particles from the dust. P100 respirators are always superior to an N95. And then we have anhydrous ammonia. So this one's a nasty one. It can cause severe burns. It can cause corneal burns, eye injuries. It can actually burn your airways and your lungs. It can cause respiratory failure and pulmonary edema, where your lungs swell and fill with fluid and you can't breathe. Why it does that is it actually, when it hits your mucous membranes and in your lungs, it mixes with your natural body fluids and it activates, and it essentially burns the insides of your lungs. This one is probably the highest risk fertilizer. Long term, same kind of stuff: chronic cough, airway disease, asthma, COPD, those kind of things. For this one, an N95 or a plain P100 isn't enough because ammonia is a gas. The recommendation for the ammonia exposure is actually a full face P100 with an ammonia or methylamine cartridge. For some reason you're working in confined spaces or there's a ton of it in the air, they recommend SCBA. Protection-wise, in short, if you're just doing everyday fertilizing and it's mostly dust exposure, N95 or P100, if there's any gas component like ammonia, you have to really protect yourself, either with supplied air or full face with the appropriate cartridges. Thank you for your question, guys, and I hope that helped, and I'm going to try to get some more farming exposure videos done for you. Take it easy.